Hi there! In today's video, I will be presenting Lincosamides, where we will discuss its definition, therapeutic indications, mechanism of actions, and its adverse effects. To begin with, Lincosamides are derivatives of an amino acid and sulfur-containing octose. They are monobasic and more stable in salt forms. Lincosamide are class of antibiotics which includes Lincomycin, Clindamycin, and pyrrolymycin. Therapeutic indications and dose rates. The Lincosamides are indicated for infections caused by susceptible gram-positive organisms, particularly streptococci and staphylococci, and for those caused by anaerobic pathogens. Clindamycin is approved for use in cats and dogs for treatment of infected wounds, abscesses, and dental infections. Clindamycin has also been used to treat selected protozoal diseases, including toxoplasmosis, but usually in combination with other antimicrobials. Lincomycin and clindamycin bind exclusively to the 50S subunit of bacterial ribosomes and suppress protein synthesis. Lincosamides, macrolides, and chloramphenicol, although not structurally related, seem to act at this same site. The lincosamides are bacteriostatic or bactericidal depending on the concentration. Activity is enhanced at an alkaline pH, and efficacy is considered time-dependent. Lincosamides are generally ineffective against facultative anaerobic but not anaerobic gram-negative bacteria. Resistance to lincosamides appears slowly, perhaps as a result of chromosomal mutation. Lincomycin has a limited spectrum against aerobic pathogens, but a fairly broad spectrum against anaerobes. Clindamycin is a more active analog with somewhat different pharmacokinetic patterns. Many gram-positive cocci, except for enterococci and mycoplasma, are inhibited by lincosamides, but most gram-negative organisms are resistant. Clindamycin is less effective towards ureaplasmas. Bacteroid species and other anaerobes are usually susceptible. Clostridium difficile strains appear to be regularly resistant. No serious organ toxicity has been reported, but GI disturbances do occur. Clindamycin-induced pseudomembranous enterocolitis caused by toxigenic Clostridium difficile or disruption of GI flora is a serious adverse reaction in a number of species and can be lethal. Thus, clindamycin is contraindicated for use in horses, guinea pigs, hamsters, rabbits, chinchillas, and ruminants. Lincosamides are contraindicated in horses because severe and even fatal colitis may develop. Skeletal muscle paralysis may be seen at high concentrations. And that's the end of my presentation for Lincosamides. Thank you and stay tuned for the next video.